So our next speaker is going to be Ms. Rosalia Guerrero. Hope I'm saying that correctly. So she is a certified community health worker instructor and serves as the manager of the Texas Public Health Training Center and then also the CHW training program at the University of Texas School of Public Health in Houston. Ms. Guerrero is also the president of Healthcare for All, Healthcare for All Texas, which is a volunteer grassroots organization whose mission is to promote single-payer healthcare for all by educating the community and influencing public policy. Previously, Ms. Guerrero spent 10 years working with promotores in the Colonia communities along the Texas-Mexico border. So if we could welcome Ms. Guerrero.
I'm not as tall as Ken, and I also don't talk as fast. So, and I don't write as fast. I try to get down all his questions because I want to give the guy a break and answer at least a couple of them. So I'm going to put those there. So again, I'm with co-chair of Healthcare for All Texas, which is actually a chapter of Physicians for a National Health Plan, which has been around. It's a national nonprofit, grassroots among physicians. There's about 18,000 of you that are members, and maybe we have some members in the room today. And if after this talk you'd like to become a member and get involved, there's some applications and brochures up front that you can pick up. I would like to just go, I only have one slide, and it has like 5 points. Because I did want to highlight a couple of things that Ken was talking about, and also maybe a couple of questions, cut y'all off at the pass at a couple of questions, and hopefully define some of the some of the items we were talking about. So the first point is this idea of single payer and a universal healthcare system. And universal healthcare system basically says everybody is in, nobody is out. So that means those that are working, not working, those that immigrants, which the ACA left out, which you see in your emergency room every day. This means people who are self-employed or trying to start a business but won't leave their job because they need health insurance, and people with pre-existing conditions. So when we say everybody, it basically means everybody. Next one is, oh, and I will say a little something about that. A few years ago, really after, people think that the recession is long gone, but a lot of people are still suffering after the recession. And I had the privilege of spending a lot of time around front desks, where people come in and check in. And I was always, it wasn't like the very poor who've never had insurance or kind of used to finding care where they can, but it's those folks that were like near retirement or maybe had lost a job or were trying to look for another job, and they were just trying to make their appointment, and they really couldn't believe that they weren't covered, that it was like the stark reality, and that there was really nothing they could do. They really couldn't even pay out of pocket. And they had no idea of what an FQHC was or what a community health clinic was. They lacked total health literacy, even though they were engineers and professionals. They totally lacked knowledge about our safety net, which really isn't very safe. The next benefit would be more money for medical services. And yes, it sounds like, oh yeah, we're going to have more money, because we're going to spend all these trillions of dollars. One of the things that wasn't mentioned was all the money we're going to save by all the waste that's going on right now. So in 2017, I think the last time they checked, there was about, we spent about $500 billion a year. That's 1 year. Basically in profit and administration. So with the single payer system, that would basically go away. And I will discuss about what happens to the, the poor insurance agency once they're gone. And, I want you to feel bad for them right now. So that means more money for hospitals with this other thing. It's not just you're going to receive like some kind of very low Medicare rate. It's actually going to be a little bit higher. But hospitals are also going to receive lump sums like they do in Canada. The hospitals receive what they call a global budget that they negotiate every year. Now for patients, and Ken mentioned this, there would be no premiums or co-pays and deductibles for patients, so they could just go see their doctor. And right now, about those $500 billion, a third of every dollar goes to administration. So that would though we get to save all of that, and that goes to patient care. That also ends when for-profit insurance companies goes away. What goes away is their interference in the doctor-patient relationship. So, they invented pre-existing conditions. We did not. So all these terms that the insurance uses basically to keep costs low and profits higher basically interferes with how doctors actually care for their patients. So that would go away. A healthier workforce. I think this is really important and no one really talks about it. What about our care providers and their quality of care, right? It has to be extremely stressful and frustrating knowing that, you have losing everyday control over the care you give to your patients, having to deal with all this billing, having to deal with malpractice, because malpractice actually goes down during single payer. That's the experience. Going back to the insurance companies, what happens to the folks that are actually doing the claims? There's actually a very high turnover rate because that is a bum job. It really is. It sucks as far as jobs goes, and people do not last very long in those jobs. And unfortunately, a lot of people that do billing claims in doctors' offices are healthcare professionals like nurses. They're the ones who land up filling out all that paperwork and answering the questions. So when they stop doing that, they can actually go back to giving care, which is what they wanted to do in the first place and not fill out paperwork. I don't know if, this has probably been a year that NPR had done like a special report that was based on a Medline research that basically says, that showed one doctor kills themselves every day in this country. That's the highest of any profession and twice what's in the general public. Now, am I saying that the ACA is killing you? No, I'm not saying that. But it did basically say that the stress that doctors are under today is much more than in years past. It's just not as gratifying being a doctor today than it used to be. And what we've seen, our doctors are starting to agree, especially our younger doctors. So they're basically coming over to PHMP in droves, and now over 50% of doctors actually support a single payer. AMA had their meeting not too long ago, and actually they always vote down single payer, every year, but this year they did it by the slimmest margin. I mean, they were really close. And they really had to do that by, basically putting out a little bit of propaganda. I was kind of surprised what some doctors kind of like fell for. That clinics and hospitals were going to shutter their doors because there's not going to be any money, that they're going to get paid minimum wage and things like that. Actually, it's been shown that when countries switch over to single payer, that doctors' incomes do not go down and their quality of life goes up. And I can't say enough about one's peace of mind and quality of life. In the last room, this is a little I'm not going to down the ACA, and actually the attitude is we should put all our efforts behind the ACA as we're moving towards single payer, because that's part of the transition. And even President Obama wrote an article recently about how that should happen. So, you know, just because we're moving over to single payer doesn't mean that the Affordable Care Act was a failure. If anything, it showed that we can change together, that even though people think very differently, we all moved, and even people that were against the ACA are now, you know, we don't want to lose it, because once somebody has it, something, they don't want to lose that, no matter how little it is. But a little dirty secret about the ACA, to pay for that, because since we kept the insurance companies, we couldn't take money from them. So who they took money from was basically public health. So public health has really suffered under the ACA because we haven't got, you know, no public health research, dollars are dwindling, schools are suffering. So it's really hard to do public health, and that's basically my genre. There's just less dollars to do public health activities. I currently am working on a hepatitis education and screening, because in Harris Health, hepatitis C is growing faster than anywhere else in the country. But guess what? There's no money for screening. We can go out and educate, but our dollars for screening actually dried up. So, you know, you're gonna, you know, see these folks in the clinic when it's a little too late. So that is basically, oh, let me get to these questions, because I think I have a little bit of time. I'm good on, he's like, yes. With the displacing the 160 million people on private insurance, they will actually will move over to single payer. They're not going to lose their doctor. They get to choose what hospital they go to now, but it won't be the private insurance company that dictates what doctor you go to. You know, so right now the private industry basically says, you know, who's in network, who's out of network, you know, all of those are terms that insurance made up. They do not exist. So under a single payer, people will just keep on going to their doctor. They just won't have a deductible or a copay. Does doctor income go down? I think I alluded to that. In other countries, it did not. In Canada, it did not. And you asked doctors today. And I did mention that actually the gap in pay between specialty and primary will reduce. Let's see, about federal taxes. Well, right now, 2/3 of our healthcare system is supported by taxes. The other third will be made up by those savings from the insurance company by doing away with all the administrative waste. There will be like a little gap. We don't know exactly what that is because, as Ken mentioned, it's extremely complicated. So we do know that there will be some type of gap, which will have to be made up with a progressive tax. However, each family today pays around out of pocket about $15,000. That's if they have private insurance. So they're going to pay less in taxes. We all will at the end, but we will have to take it there. And as far as going back to what happens to the insurance company and everybody who works for them, the PHMP is already working with unions around the country to develop curriculums and a plan for retraining folks who, if they're healthcare providers already working in the insurance company, they will be welcomed back into the medical field because there will actually be, excuse me, a need for healthcare providers. So we're going to need all the nurses, all the doctors that went to the insurance industry, we will need them back like pronto. And then for those who basically just do billing, there's a plan to have them retrained because we will also need them to come into the healthcare industry. One more thing I had here on my notes is that goes with healthcare providers. we can't forget some of our lower paid healthcare providers. Like Paul mentioned, I work with community health workers, promotoras. Most of the community health workers I work for, even though they work in clinics, do not have health insurance. So it's a sad day when our healthcare providers, those who care for those that need it the most, cannot get coverage themselves. So I think with that, I will save the rest for your questions when we get back together.